They keep the NHS running, the nurses and doctors on the front line. But it is a front line increasingly staffed by agency and contract temps. And last year they cost the NHS in England £3.3 billion. This is all about staff shortages before the mid-staff scandal and the race to fill positions since. The government claims rip-off agencies are forcing managers to ignore the pay cap, which they call the framework rate.
We're stopping that, so we're saying hospitals will only pay the framework rates, and that means that agencies, if they want business, will have to charge reasonable rates, not extortionate rates.
A staff nurse on grade 5 is paid £12 per hour, but some agencies charge £52 per hour to provide a temp. While in one last-minute case, an agency charged more than £180 per hour. The agency took 50%.
Atlantis Medical House speaking, how can I help?
It was not this agency, which says most of them stick to the framework rate. So how do they react to headlines about rip-offs?
Well, anger initially, because yes, like any other industry, there are some that do take above the odds when it comes to charge rates within our sector, but the majority of the agencies, especially like ourselves, we do stick within the guidelines of the framework.
So not a 50% commission?
No, nowhere near, nowhere near.
The Nurses' Union says that pay, conditions and morale mean that the NHS is losing its own staff to the agencies.
There is a place for agencies and agency nursing. We absolutely should be able to use agencies as a last resort when, for example, somebody goes sick at very short notice. The situation that we've got into, as opposed to using them as a last resort, we're using them as a first port of call.
On one issue, they all agree. The NHS needs more full-time staff. It's better for the bottom line and for everyone on the front line. Simon Viger, 5 News.